Good afternoon. Welcome, buenas tardes, and welcome to our first episode of Community and COVID-19 Lunch and Learn. I'm Fernando Valenzuela.
And my name is Janely Petance. El video va a estar disponible en español muy pronto. Fernando and I are part of the COVID-19 outreach team here at Hispanic Health Council in Hartford. What we do is we go out into the community to educate them everything there is to know about COVID-19 regarding vaccines or just the COVID-19 in general. And we come across a lot of hesitation and a lot of barriers, especially in the Black and Brown communities. And because of that, we decided to do this live webinar series to help educate our community and to let them know about the hesitations or barriers. And the webinar series is happening every third Wednesday of each month, discussing different topics with different guests.
Yeah, so like Janelle said, the main goal with this video series is to bring on special guests every month to give the community more information to help them with any hesitations they might have regarding COVID-19. So we will have a Q&A towards the end of the webinar. So if any of our listeners have any questions that they have regarding COVID-19, feel free to submit them in the chat and we'll get to them, or we'll get to as many as we can at the end. So with that said, I would like to introduce our first guest today. We have Dr. Salazar, who is the Physician-in-Chief and Executive Vice President of Academic Affairs at the Connecticut Children's Medical Center. He's also the Director of the Pediatric and Youth HIV Program at CCMC and serves as Professor and Chair of the Department of Pediatrics at the UConn School of Medicine. Dr. Salazar, thank you so much for joining us today.
Janelle and Fernando, it's really great to be here with you and with all the folks that are joining us for this very important meeting. Es un placer estar con todos ustedes.
Gracias.
Thank you so much. Any other information you want to tell us about your career, about yourself, that you want to share?
Yeah, absolutely. So it's been really an honor to be serving this community now for 23 years. I'm originally from Colombia. I was born in southern Colombia in a small town called Popayán. 59 years ago, so it's been a while. I grew up in Colombia, moved to the Washington area when I was at the age of 12 with my father, who was also a physician and worked in public health with the Pan American Health Organization, which really takes care of healthcare for all in the Americas. Went to medical school back in Colombia. When I was 17, I decided to go back to my home country to get reacquainted with my origins. That was a great decision because that's where I met my wife in medical school. So we've been married. Tomorrow will be 32 years. She's also a pediatrician here in the area. She's a pediatric cardiologist. But then I trained here in Connecticut. I arrived here in 1988 as a pediatric resident. That's when I learned about the very large Puerto Rican community, very rich and wonderful Hispanic community in Hartford. It was great because I could actually use my bilingual skills with my patients, many of the kids in the inner city that I was able to take care of for many years while I was a resident. Did my fellowship in infectious diseases in Minnesota, a little bit colder, and went back to Colombia for about 3 years. And then I've been back in Connecticut at Connecticut Children's and the University of Connecticut School of Medicine since 1998, in November 1998. So it's been a long journey. I've loved it, every single minute of it. And since my arrival, I've served the community, providing care for kids with infections. I also direct the HIV program with an amazing group of people that take care of kids with HIV and adolescents with HIV. And since 9 years ago, I became the Physician-in-Chief for Connecticut Children's, the Chairman for the Department of Pediatrics, and the Executive Vice President for Academic Affairs. So it's been a long, wonderful history with the Hartford community, with Connecticut, with my friends and colleagues in the Hispanic community. Certainly the Hispanic Health Council has been a great advocate for all the things that we do. And over the past 2 years, I've been working with you very closely to deal with this pandemic that has been just remarkable in terms of how hard it has hit our community, and it continues to occur. So we have to be prepared. We have to be knowledgeable. We need to understand how we can prevent it, how we can treat it. What are the things we need to do to survive into the time where we can say the pandemic's behind us, but we're not there yet. So anyway, so thank you for inviting me. It's a real pleasure to be here.
No, thank you for that. That was amazing.
Yeah, really interesting background.
Yes, for sure. So our topic today is the pediatric vaccinations. So recently, in the beginning of November, the vaccines were approved for ages 5 to 11, just through Pfizer, and it opened up about 28 million people in this age group. So according to the CDC, as of December 5th, 2021, 4.8 million US children ages 5 to 11 have received at least one dose. That's less than 17% of children in that age group. So can you just broadly talk about the children vaccine and why it's important for them to get vaccinated?
Yeah, thanks, Janelle. That's a great question. So, as you said, the Centers for Disease Control and the FDA gave approval for the Pfizer vaccine to be given to kids 5 to 11 about a month ago, and a little bit over a month ago. And that was a great day. I still remember hearing the news about that, because now we can actually offer this vaccine to the younger population, 5 to 11. And I'm asked, this is a very common question that I'm asked every day. And number one, why is it important to vaccinate children? And number one, what are the side effects if you vaccinate the kids? And number three, why are the kids not getting vaccinated? And why is it only 20%, a little bit less of our population? So begin with the first one, which is really, really important. And the answer is kids 5 to 11 do get infected. They absolutely do get infected. There are millions of kids that have been infected in that age group. Kids 5 to 11 can get actually very sick from COVID and end up in the hospital. There are about 9,000 kids in the US that have ended up in the hospital between the ages of 5 and 11. So it's not insignificant. It's a lot of kids, not as many as the adults, of course, but 9,000 children have ended up in the hospital, which means they needed oxygen. They needed to be in an intensive care unit. Unfortunately, some of them have died. So between the ages of 5 and 11, about 100 children have died as a result of COVID-19. Those are 100 kids that, if we had a way to prevent the deaths of those kids, no parent will say no. And every parent loves their children. And if they thought they could do something to prevent hospitalization or death, that's the kind of thing you would do it. You would say, yeah, absolutely, we want to do it. It is true. Most kids have a mild disease and they don't end up in the hospital. Most kids will do okay. But again, you don't know if your child is going to be the one that ends up in the hospital. And you certainly don't know if your child is going to be the one who potentially could die from this. So as a parent, and I have 2 kids, much older now, they're not children anymore. But every decision my wife and I made was always to make sure that whatever we did for them was on behalf of safety. Giving them their normal pediatric vaccines, making sure they wear a seatbelt, making sure they were in a car seat, for children when they're younger. These are all things that we do all the time to make sure that our kids grow healthy and don't end up in the hospital. So again, COVID, although most cases in children are going to be mild, which is good news, kids can get sick and some kids can die. So that's the first thing. That's why, this is really important to try to prevent. So the second thing is then that, is this vaccine safe? And these vaccines have been given now in the US, we've given, close to 400 million shots of these vaccines to people, and they've been really well tolerated. This is something that we have a lot of information, more information than we've ever had for any drug, frankly. I mean, this is, people say, well, we don't know enough. We do. We know a lot, and they're actually safe. So I can be very confident telling a mom or a dad, this is a safe vaccine for your child. That's the second thing, and that's why it was approved, by the FDA. Otherwise, it wouldn't have been approved. It took a little bit longer. Why? Because we wanted to make sure that the vaccines were good for kids as well. So we don't have the younger indication yet, 6 months to 5 years or 4 years. Hopefully that's coming, because we'll need that. So that's the second thing that I tell parents. And then, the next thing is, why are parents not getting their kids vaccinated? And, maybe through the through our dialogue, we can give you some ideas of why that is, and perhaps, give some more information to parents on how they can make a decision on whether or not they go for the vaccine for their kids or not. So let me stop there for additional questions.
Thank you so much for that really thorough response.
Yeah,
You hit a lot of great points there.
Definitely. Thank you for letting know why it's important for children to get vaccinated. So another question. So is there a difference between the children vaccine and the vaccines that's been approved for 12 and older? And if so, like, why was there a separate children vaccine created or developed?
Yeah, so great question. So let me dissect that a little bit. So the obviously a year ago today, I was the first one to get vaccinated here at Connecticut Children's when the vaccine came out. So it's been a year since the vaccine was approved. It seems like an eternity, right? But it's only been a year.
Wow.
And of course, the vaccine was approved for individuals 18 and older. And in that first wave of vaccinations, we wanted to get obviously the elderly, people over the age of certainly over the age of 80, older individuals over the age of 65, and healthcare providers, were a part of that first wave because we were seeing patients coming in with COVID. But it was a great day. I remember that. I still remember the day that I got the vaccine, and it was a sense of safety, a sense of exhilaration that, that really, we finally had begun to turn that curve. And then the vaccine was really taken up here in Connecticut really well by the adults. They've lined up to get the vaccines. And then the population in Connecticut has been well vaccinated for the most part. The FDA, they looked at that and they said, well, we can probably extend it into 12 to 15-year-olds, 12 to 17-year-olds. So they faced it, first the adults, then the teenagers, then the younger teenagers. They were using the same dose of the Pfizer vaccine for all those. But they didn't approve the ones for children until they had more information. And what they learned is that you can actually give less amount of the vaccine for the younger kids and have equal protection. And that has made a huge difference in the sense that, the kids can get a third of the dose. The adult dose and the adolescent dose is 30 micrograms of the Pfizer vaccine. The pediatric dose is 10. You give it in 2 doses. And we have given a lot of shots here in Connecticut to thousands of kids, and they've done really well. And I have to say that we haven't seen any of the side effects that people were concerned about. In the 12 to 18-year-old group, there was one side effect that was documented, rare, but it did occur, that in a small number of kids, maybe 10 to 12 per million kids that got the vaccine, some of them did get inflammation of the heart that lasted for a few days and then they recovered. We haven't seen that in the 5 to 11-year-olds. It just hasn't occurred. And I think the lower dose actually makes sense for the younger kids. And I'm guessing for the even younger kids, and maybe even a smaller dose. So there are differences between the dosage of the vaccine. The vaccine is otherwise the same, equally effective. You get antibodies. So it's a good product. But we always are careful, especially with the younger kids. We want to learn more. And this is not unusual that drugs get approved a little bit later for pediatric age group, and we begin with the adults. And we did that here, and I'm very confident that was the right move to do. I hope we can get the younger population also vaccinated.
Perfect. Thank you for the clarification on the vaccines between children and the people are ages 12 and up. So another question. What information do you have from other major companies creating their own pediatric vaccines? If you know.
Yeah, so many of the companies are also, in fact, all of them are doing pediatric trials.
Okay.
So if you go to Latin America, I speak with my colleagues in Colombia, and they're vaccinating in Colombia. They're actually vaccinating 3-year-olds and above with Sinovac, which is it's the Chinese vaccine. They actually, so they're vaccinating the younger kids with. And they've done the trials. It's not available here in the U.S., and it probably will not be available here. The Novavax, another company, is doing trials for children as well. Moderna is doing trials for children as well. And so almost every single one of the vaccines has always a pediatric trial that is going through the pipeline. Pfizer just got ahead of everyone and actually got the information more quickly to the FDA. they looked for the approval and they got approved. But I suspect that over the next 6 months to 12 months, we'll have not just one company, but several companies that can be used for pediatric vaccines. So it's in the horizon, and that's good. We want to have several options for the children, not just one option.
Yeah.
Perfect. So right now it's just Pfizer that's been approved for ages 5 to 11.
Yeah, only Pfizer, 5 to 11. Only Pfizer for boosters for 16 and 18-year-olds. That's a new indication as of last week. Correct.
Perfect. Thank you for that.
So, Dr. Salazar, I wanted to talk a little bit about some of the hesitancy that we've seen. I know you mentioned that the vaccines are safe, but when we're out in the field talking to the community, we still see a lot of hesitation. And some of the most common things that we hear is something along the lines of people just wanting to wait more time. Kind of like you mentioned before, people think that the vaccines came out too quickly, and they come to us and they say, well, I just want to wait more time to see the long-term effects. So I was wondering if you could speak a little bit about the vaccine approval process and how this process ensures that the vaccines are safe, specifically for children.
Yeah, so let me answer that question a little bit differently, Fernando, because I've spoken to many parents. Sometimes I spend an hour with a family. They reach out to me and say they want to talk to you about the vaccine. And the question you asked is correct. The parents will say, okay, I understand that many millions of doses have been given to adults and to maybe adolescents, but not so many for children. And so I'm worried. The question they asked me, with this Pfizer vaccine, I'm worried about potential long-term side effects, like 6 months from now or a year from now, and I don't know what's going to happen with this vaccine. So it's a fair question. I appreciate the question. I think it's a good question. As a parent, you need to question these things. You want to ask, because you want to do everything that's right for your kids. So the way I respond to that is the following way, Fernando. The first thing is I tell the parents, you're looking at two things. You're looking at vaccines that are new and the potential side effects of the vaccines. And then you're looking at the infection, COVID, which is also new, and the potential side effects of COVID. And you have to weigh the risk of one versus the other and then make a decision that's the right decision for your child. So on the vaccine side, so first I tell them about the vaccine. So these vaccines, which are the Pfizer vaccine, which is the only one that's approved for kids, is made of something called mRNA, messenger RNA, which is a small, very tiny little molecule that's put in a little piece of lipid or a little bit of fat, tiny fat bubbles, and that's what's injected into your arm. And then that little piece of mRNA, a little tiny thing, which is like a little factory of protein, goes into your cells, and then your cells start making a protein, which is that mimics very close to one of the proteins of the virus. It's called the spike protein, a little spike protein. So your cells make spike protein, which mimics what the virus has, but not the entire virus, just a little piece of the virus. And that what your cells make then is your immune system picks it up. It surveys it, it picks it up and says, oh, okay, let's make protection against this protein. And you make antibodies, which are the ones that actually protect you from infection. Now, the actual vaccine only lasts, what is injected into your body only lasts in your body about 24 hours, and then it's gone. Okay, so what the injection comes in, it goes where it needs to go, it uses your body to make more protein, and then it disappears. It gets chewed up and is gone. So you don't have, within 48, 72 hours, you don't have vaccine left in you anymore. It's gone. What you have is the protein that was made so that your body identifies it and says, next time I see something like this, I'm going to make sure it doesn't cause harm. That's protection against the virus, but it's gone. So there is no long-term side effect because there's nothing left in your body. It's all gone. It's all metabolized. It's picked up by it's like a little trash. It's gone. So there's no chance the vaccine can have a problem 6 months later or a year later. It's not there. It's not there anymore. It came in, did what it had to do, and it's gone. What's left is your own immune system that you tricked into saying, maybe the virus was here. You tricked it. You make antibodies so that when you do see the virus, you're going to be able to fight it off. So there's no reason to think that this vaccine has any long-term side effects because it's not there anymore. It's like that. It's like you have a drink of water and then I'm just going to say you pee it out and it's gone. That's really what it is. Now, what about COVID? What about COVID? So we know that, and I tell the parents, we know that, yes, for most kids, it's probably going to be like a mild flu or a cold. Some kids may not even have any symptoms, and it probably goes away. That is correct. And that's good news for the kids, okay? But what we don't know is, because this is the whole virus, this is not just a little piece of the virus, I mean, or a piece of the machine that makes the protein. This is the entire virus that infects you. And what we don't know is what are the long-term effects of that virus. That's a whole different story. And what we're learning is that there are problems associated with the virus, even with people that have mild disease. So we're learning a lot about the virus, and you've heard on the news about the long haul syndrome for adults. We're now seeing long haul syndrome in kids that might not have been very sick in the beginning, but are now having issues with, concentration in school, having headaches, difficulty with their heart, the lungs. There are things that we're beginning to learn about this virus that goes into your body, and this one may stay in there for a couple of weeks, even a month, causing all kinds of problems. And what we don't know is what are the long-term effects of the actual infection. We know that short-term effects can you can end up in the hospital from it. You can also end up, and rarely it happens in children, but kids can die from this. But let's say that's not, you take a risk. You say, well, that's rare. It's not going to happen. What you don't know is if the mild disease is going to cause a problem. So when you weigh one versus the other, is if I have something that can prevent my kid being in the hospital, something that can prevent my kid from dying, even if the risk is low, and the risk of doing that is really low for anything because it goes away very quickly, versus something like the virus, which is also very new, and we don't know, what are the side effects. Then as a parent, I'm going to weigh the risk, and it looks like this, infection up here with potential risk, vaccine down here, and then that allows the parent to make the right decision for their child, because you want to put everything in the favor of your child, and that's how I see this in terms of making a decision. And but I understand, I get it. I mean, I love that the parents ask. They have to ask. It's a good question to ask.
Yeah, that was a really great way of framing it, and I learned a lot of stuff that I didn't know before about it. Because something else that we hear from parents is that the weighing out of the things, because they'll talk about, oh, well, my child, if they get COVID, they'll be asymptomatic. They're going to have mild symptoms. So it's kind of tough because we hear a lot of parents saying that, and then they say, well, so what's the point of getting the vaccine? So I think it's a good way for you to mention that, to focus more on not knowing the long-term effects of COVID itself.
Exactly.
So I wanted to talk a little bit about body autonomy. Something that we're seeing with the child vaccine is situations where maybe a child wants to get the vaccine, but the parent is unwilling to take them to get it. Or also the other side of that, where maybe a child feels a little uncomfortable with it and the parent is taking them to get the vaccine. So I was just wondering if you had any thoughts on this dynamic, and if there's anything we can do to ensure that the voices of both children and adults are heard in this situation.
Yeah, thanks, Fernando. That's a great question, and I've seen it. I've seen the scenario that you describe is one that I've come across where a teenager, somebody who's 15, for instance, who does not want to get COVID, and they've done their own search. They have access to the internet. They have access to Facebook posts like this one, and they say, you know what, I don't want to get COVID. I want to get vaccinated. I know it's available for me at 15, but the parent does not want to get the vaccine, and that happens. So, unfortunately, there are legal limits that as a provider I have to provide a vaccine to a minor where the parent does not allow us to do that. And unless they're an emancipated minor, which what that means is they have, through a court of law, they have established that they're emancipated, so that they make their own decisions. That can happen. There's 16, 17-year-olds that have that level of sophistication that they make their own decisions, and then they decide to get the vaccine, and it's their own decision. But unfortunately, sometimes it runs into the opposition from parents who are concerned about getting the vaccine themselves and don't want their kids to get it. the only approach that I have, it's got to be within legal means, of course. I can't give a product, unfortunately, that where the parent, the legal guardian doesn't allow by signing a note saying you can go ahead and do it. So the only approach for me is talking to the child, but also talking to the parents, and then trying to make them understand why your son or daughter is actually quite afraid of this disease, and it's not really fair, but you have to do it in an educated fashion to try to go through what we just went through a little while ago. Why is it important for them to get it or not get it? So that happens. Now in Connecticut, obviously, if an adolescent, even over the age of 14, for anything related to reproductive health, birth control or anything related to sexually transmitted disease, diagnosis, infection, in that case they have complete autonomy. They can actually seek care at age 14 and above, and we as healthcare professionals can provide that care. But a vaccination that is outside that environment is going to be not possible unless the parents have consent. Now, so that's one thing. So unfortunately, we have to work with information campaigns, trying to understand why the parent is opposed to it, trying to give them more information, and then but you have to stay within the legal limits of this. Now, the other way around, I think you mentioned, Fernando, is what if the parents want the vaccine for their kids, but the kid is not wanting the vaccine? In that case, normally I want to understand why the kid doesn't want the vaccine. The younger kids, they're 7, 8, 9-year-olds, may just be afraid of needles. Mm-hmm. So in that case, what we have to work with the parent and the kid is just to try to make it in a friendly environment where we can actually give the vaccines, to the kids in a way that is almost a game. And we know how to do that in pediatric settings. We vaccinated a lot of kids at Dunkin' Donut Park the other weekend. And we had our child life specialists there. We had clowns. We had all kinds of people that were making the kids, feel like this was a fun event and it was a cool thing to do with stickers. And for the most part, kids would just sort of put their arm, maybe a little tear, but then they would be fine. So it's a lot of information. Now the parent, the parent does have the ability to bring him in. It's hard to force if a 16-year-old doesn't want to do it. And a parent wants him to do it, we generally would not force that kid. We're not going to hold him down and give him an anesthetic to give the vaccine. I think that's just not logical, and we would tend not to do that. If you have a 5-year-old, 6-year-old who is just very much afraid of needles, that's a different situation, because there is more fear as opposed to I really don't want to get the vaccine. But if you have older populations, I think the adolescent needs to be respected. Needs to be protected, and the adolescent with good information, it is autonomy. Their bodies are theirs, and they should be able to make that final decision. And hopefully they make the right one. But it's a very difficult situation in both directions. So you point out to something that we've run into all the time.
Yeah, and I think those legal limitations that you mentioned mm-hmm. really highlight the importance of the conversations that we're having, like this one, where people can have access to information to help them make the right decision.
Right.
Perfect. So I know we talked about a lot of the hesitations prior, but in your field, since you see a lot more action than we do, are there any other concerns, barriers, or hesitations that you see regarding children getting vaccinated?
Yeah, unfortunately, I think there are 3 groups of parents. There are 4 actually. There's those that wanted the vaccine before they even came out. In fact, they were quite vociferous. They wanted it immediately, and they were very happy when it became available. So they know this is what they want. It's easy. There's another group that just wants, they want to really know the science and the information before they make a decision, and then you're able to provide them the information, and then they'll weigh it in, they'll look at they'll ask the proper questions, and generally those parents are going to agree that the kids get vaccinated. There's a third group of parents where they're just not sure yet, right? Because they rightfully say, well, this is kind of new. It is new for kids. We started vaccinating 5 to 11-year-olds a month ago. For polio, we've been vaccinated since 1950. For measles, since the 70s. For hepatitis B, since the 80s. So those vaccines have a long, long, long history. So parents say, well, that's been around for 40 years, 30 years, 20 years. This one has been around for a month for 5 to 11-year-olds, and so they want to know, they want to know a little bit more. But and then when we tell them, there's a lot of safety data. We've used it, over 400 million shots in adults and young adults, several million doses in 12 to 15-year-olds, and several thousands, now millions of doses in the 5 to 11. We haven't seen anything that worries me. And here's the information. And generally, they want to get to yes, they just need a little more information. And so with those three groups, we can get to probably 80% of the population, 85. There's going to be another group of parents, and I'll divide that in two. There are some that are completely anti-vaccine, no matter which vaccine. Those, and we're running into that now. That may be less than 1% of parents that don't want any vaccine. And they've been around since before COVID, and they'll be around after COVID. Those are folks that unfortunately do not believe in vaccines, and they feel that that's not what they're going to do. The other group is one that is perhaps listening to the wrong information. The social media can scare people. Social media is like a megaphone, and if they listen to somebody either on television or social media that's saying these vaccines kill, for instance, that's all they may hear, and they say, I'm not done with this. So our job is to provide the right information, because there's a lot of misinformation for parents, there's a lot of misinformation for people that they don't want these vaccines, and because they get afraid. I mean, the things that I've heard is that they're going to put a chip in my body. There's no such thing as a chip in your body with this. The second one is that this is going to make my daughter or my son sterile, so that they can't have children anymore. There's absolutely no truth to that. Absolutely no truth to that. From that perspective. The third one is just some sort of government conspiracy that's taking us over by doing this. But this was made up by Dr. Fauci, or was made up by Pfizer, or was made up by the Chinese to do something to us. And none of those things are true. I think what we know is this virus has been a deadly killer in the U.S. We hit 800,000, generally and for another 800,000 Americans as of last night have died because of COVID-19. This is a serious disease. So we have to, eliminate the misinformation that, the vaccines are some sort of conspiracy, some way to take us over. Not true. It is simply not true. And unfortunately, there's a lot of stuff out there on the internet that people believe. And so it is. So I'm so glad you're doing this, because we have to make decisions that affect our children positively and listen to the right information, because negative information can actually have the potential of holding you from giving a vaccine to your children, and that disease could potentially kill your child, put them in the hospital, or give them long-term consequences. And I know parents don't want that, but sometimes they get fooled into that by misinformation that is not true.
All right, thank you for that. I love how you mentioned all that great information. Apart from all of that, especially in the Latinx community, where else can community members find information regarding COVID-19, apart from this great webinar series that you're providing information? But where else can they go? Because especially in, like I said, in the Latinx community, we need more facts and correct information about COVID, especially with COVID and the COVID vaccines and the boosters. Where can they get that information?
Well, the traditional sources is, the first thing is I love for parents to talk to your pediatricians. These are the doctors or nurses that have been taking care of your children since they were born, and their only interest is the health of your children. They don't make money on these vaccines. They're not trying to sell anything. All they care about is that your child, your son or daughter, remain healthy. That's really the goal of it. So your healthcare provider is your best source of information. When parents have come to me with questions, and they're good questions, if I sit down with them and tell them, look, as your doctor, for your kid who I've known since they were 2 months old, my recommendation is that this is in the best interest of your son or daughter at the age of 5 or 6 or 7 when they can get the COVID vaccine. What questions do you have? Then I go over some of the things that you and I have talked about, and that's reassuring to them. So your healthcare provider, your healthcare center, your hospital, the place where you normally go to, is the best source of information. We have on our website at Connecticut Children's, and it's www.connecticut.gov. connecticutchildrens.org, and perhaps we can share that information through the web. We have a lot of information that is in simple language for families to understand about COVID-19. Now, the other place you can go to is the Centers for Disease Control, cdc.gov. A lot of information for families in both Spanish and English that you can go into. Obviously, the Hispanic Health Council, some of the websites that you have that are more local communities are places where we should go. We have a great primary care clinic here as part of Connecticut Children's CHC Inc., Community Health Centers Inc. They've been doing a great job with information for all our families and you can go there. Many of the federally qualified health centers in the city, in the state of Connecticut, will have information. So healthcare team members, your docs, your nurses, CDC, those are places where you will get real information that is not made up. It's not something that somebody said. So just be careful where you log in and what you hear about, and ask your doctors. Is this something that's real? Tell me. Why would your doctor lie to you? Doctors don't want to make stuff up for kids. We want to do the right things.
Yeah. Thank you, Dr. Salazar. I want to make sure we have enough time for the Q&A, but I wanted to give you an opportunity if there's anything else you wanted to mention that we didn't touch on, or anything you wanted to reiterate.
Yeah, well, I want to thank both of you for the invitation, and I look to all of you, a toda la comunidad. This has been tough. This has been hard. It hasn't been easy. We've been doing this now for almost 2 years, and I wish I could tell you it was gone and it's not coming back. It's not gone yet. We still have a ways to go, and so the goal for your children is to keep them healthy, keep them safe, keep them engaged, keep them happy as much as you can. I think these vaccines are a way to get there, number one, but it's not the only solution. You still have to, there are things that you can do. You can wear your mask, wash your hands. And the other thing which is really important that I want to emphasize is your children's mental health. You got to pay attention to it. Here at Connecticut Children's, we're seeing many young kids that are coming in because they're depressed, they're stressed out, they're in distress. Keep an eye on your kids, your adolescents. Listen to what they're telling you. If they're telling you that they're potentially going to self-harm, pay attention to that. Don't blow it away, because this is a time where we have to be really mindful of what's going on in our kids' minds, and really pay attention to that, because sometimes they may say something, you think it's a joke, and they may act on it. So keep an eye on that. But as a community, we have to take care of each other, seek the truth. And the one statement that I've made always is through this pandemic is, be not afraid, but be responsible. So be not afraid, but be responsible. So those are the things I would like to say, and I'm happy to take questions.
Yeah, thank you for that.
Thank you. That's great. Yeah, mental health is super important. So thank you for that. People forget about it.
So we do have one question here. The question is, how can we prepare children to get the COVID vaccine? So some background information is like, I know some parents were struggling with the anxiety that the kids were maybe having leading up to actually getting the vaccine. So is there any advice that you might have for parents who are having these anxious children?
Yeah, so it depends on the age, Fernando. So obviously it's going to have to be age appropriate. So the 5-year-old, the 5 to 8-year-old, the main things the 5 to 8-year-old may have is primarily, is this going to hurt, right? I mean, 5-year-olds don't like to have anything put in their arms, and so what you need to tell them that it's not going to hurt. It's minor, actually. It's a really little tiny bite, if anything else. Some providers can actually put some numbing cream or some cold that actually diminishes any potential pain. I think you as a parent can make him feel well by saying, "I'll be there with you. It's a quick pain, but it will go away." So that's for the 5 to 8-year-old, or even 9-year-old. As you get older, the older population, they may actually be really concerned about things they've heard on the internet. So you want to ask them. So I would ask them directly. And I would ask them, what is it that worries you? Why are you concerned? What did you hear? You may have a 14-year-old girl that might have heard that if you get this vaccine, you're going to become sterile, right? Or a 17-year-old boy that may think that the government's trying to put a chip into them. So ask them, what is it that's concerning to them? And then, or somebody might have said, well, these vaccines kill. They might have heard something like that. So try to ask them what is it that is making them so concerned. And now, for the most part, these kids actually, they want to go and get the vaccine, and they, I've seen so many shouts of joy when we given the vaccines here that it was just remarkable. The kids say, finally, I'm going to be able to, get back to my friends, get back to play, get back to sports. So it kind of works the other way around. But yeah, you're right. I mean, I think there's a lot of hesitation, a lot of concern, and it depends on the age how you approach that.
Thank you.
So we do have a question. It's on the screen.
Yeah. Do you know if COVID-19 pills will be available for children?
Yeah, Joanne Cruz asked that question. So that's a great question. They're not yet. And again, like everything else with medications, they're always approved first for adults. Then they probably go into the teenage group. And then you got to make a liquid function, because many of the kids, really can't swallow the pills. So it will become, eventually we'll have them available. I'm sure the companies that are making them, Merck is one of them. They will at some point they'll make a suspension in a liquid form that will be taken. So, but not there yet. I think it's going to be a few months before we can actually have some of these adult medications, the pills to treat the virus, that will be available for children. That's a great question.
Perfect. We have another question.
Are you going to need a booster every year?
Yeah, Ricardo, thank you for that question. I'm afraid so. I wish I could tell you no, but because so many people around the world are not vaccinated, I mean, millions and millions are not vaccinated, this virus finds what we call a susceptible population because they're not vaccinated or they haven't gotten COVID yet, and it can change, it can mutate. And you've heard about Omicron. Omicron is the latest strain of the virus. It started in South Africa. It moved very quickly to Europe. It's already here in the United States. And in fact, in the Northeast, where we live, there's at least one study that suggests that 13% of all the viral infections with COVID now are Omicron. And so the answer to your question, Ricardo, is that unfortunately we will be needing boosters probably almost on a yearly basis. Whether we need one shot or two shots for a booster, we don't know yet. Hopefully it's only a single one for those of us who have been vaccinated, but this will be here to stay for a while.
So really quickly, a follow-up to that. Do you think that requiring a booster will change the needing to be fully vaccinated? I mean, do you think in order to be considered fully vaccinated, do you think we will in the future need the booster?
So yeah, I think so. And I think what's good. So first of all, I would recommend all of you who are over the age of 16, if you've had your 2 shots, go ahead and get your 3rd shot. It's really, really important. And the booster is going to be very important. And the reality is that to be truly fully vaccinated, it probably requires 3 shots, not 2. We've seen some breakthroughs of people who've had 2 shots before getting their booster and they've gotten infected. And so I think we have a little bit of a window to give the 3rd shot and avoid Omicron. Omicron is a variant that changed. It changed that spike protein that I talked to you about. The little spikes from the virus. It mutated, and it mutated to the point that the traditional, the current vaccine is only 30% effective with 2 shots, but it goes up to about 90% with 3 shots of effectiveness. So I would recommend that you do that. Now, the boosters may be a little different. The boosters, I think what the companies will do is they'll say, okay, let's make a vaccine that's good for the Omicron-like virus. So it's a little different. So you'll have your basic series of vaccination with 2 or 3 shots, and maybe in the summer, before we move on to the next winter season, there may be a different vaccine, same type of vaccine, but a different formulation. So you'll be the same street with a different house code, which is really what we probably will need. And that's probably going to go on for, several years, is my guess. We'll find out. I mean, this virus is proving to be quite formidable.
Perfect. Let's take another question.
says, with the Omicron variant now spreading, how do you feel about the Screen and Stay initiative in Connecticut schools? It has been very nerve-wracking for some parents.
Yeah, that's a great question, and we don't have all the answers for these, and exactly, this is where, from a public health perspective, and as a parent, some parents want to obviously get the kids back to school. It's been very tough not getting to school, and then keeping a kid from going to school where they may miss 10 days or 14 days and it sets them back is difficult. But, these policies with Omicron may change because it is spread so quickly, so rapidly, that I wouldn't be surprised that, coming back from the winter break, that a policy that allows you to stay in school after exposure where most of the virus is Omicron is probably not going to make sense. I think we're probably going to have to change if it was up to me, I think sometime in January, if we knew that 60% of all the cases were Omicron, where the 2-shot vaccine is not as effective, it's only 30% protective, then it was going to make a lot less sense for us to be sending the kids back to school, even if they've had 2 shots. So more to come on that. It's a great question. And if this virus has taught us anything, is that we need to keep changing. We need to keep adapting so that when we say one day may not necessarily be exactly the same, but we need to say the next day.
Thank you so much. Well, we definitely want to respect your time. Were there any final words or thoughts you want to say before we send you off?
Yeah, so Janelle and Fernando, muchas gracias por la invitación.
Claro.
Ha sido un placer estar con ustedes y con la comunidad. Estamos aquí a la orden en el Hospital de Niños de Connecticut. Manténganse sanos, por favor. No tengan miedo, pero sean responsables. So thank you again, both of you. Connecticut Children's is here to serve the community. Our Hispanic community is really important to us. It's my community, and I wish you well. I wish you a Merry Christmas, Happy Holidays, great New Year. Be safe, be not afraid, but be responsible. And thank you again.
Thank you so much for joining us on our world premiere of our first live webinar.
Muchísimas gracias.
Muchas gracias. We've been very excited for this. And you do the same. Stay safe. Have a great holiday. Don't be afraid, but be responsible.
I like that. Thank you. All right, take care.
Thank you.